A sore back, everybody, neck, those injuries. If you're in a car crash, it's so important to get looked at right after that. We have Dr. Jeff Schramm from the Utah Injury Clinic joining us in our ABC4 Backyard Now with more. Good morning.
Good morning. Thanks for having me.
If you are in an accident, doctor, what's one of the first things that you should think about?
Yeah, that is a very important question. Here in Salt Lake area and in Utah as well, people get in car accidents every day and don't really know how to handle it from there, right? There's lots of resources available to us. When you do get in a car accident, you want to get your smartphone out, take some pictures, document what has happened, call your insurance agent, report it, and obviously you want to have the ability to get checked up. So that can be either with an ambulance on scene, you can go to the hospital, or there's offices like Utah Injury Clinic where we have made that easy and available for people to come in and get looked at after a car accident.
What if after the accident, and this just happened to a good friend of mine, he said, I feel fine. I don't think I need to be checked. I think I'm okay.
Yeah, and you know, not everybody needs to get checked, but it's when your neck is sore or something doesn't feel right or you have shooting pains on the underside of your arm. These are all symptoms that you've had an injury. And we sometimes refer to them as whiplash. The clinical vernacular that we use is buckling. So you can literally see the column or your spine where it buckles from the impact of the crash. So those are the things that we want to look for. We want to get people in, we want to give them an evaluation and make sure they're not going to have long-term consequences from that crash.
It's interesting too, when it happens, you're in shock, and then later you start feeling those aches and pains. What does a sore neck mean? What happened to your neck in that crash?
Yeah, so very common for people to just not feel anything. You're nervous, you're shaking, you're excited. It's something that is, you know, can be embarrassing, it's scary. After the shock wears off, you'll start to just feel things stiffen up. Maybe you'll feel some, you know, you won't be able to turn your head to one side, or your back hurts, or you'll get pain in your hands or your feet. Those are all signs of whiplash, and those are the people that should come in and get looked at. Another thing is it's really easy. Everybody's car insurance has policies on it that cover the cost of an ambulance ride or a hospital visit or coming in and seeing one of the doctors in my office. So literally you have no out-of-pocket expense. You can come in and get looked at. There's questions around, should I get looked at? Should I go to the hospital? Should I go to an urgent care? The answer most likely is yes. You just want to go and get looked at. We've made it pretty easy to ask the doctors in our office questions, especially with the COVID-19 thing. We're trying to practice some social distancing, so on our website at utah-injuryclinic.com there's a button there and it says Start Doxy with Dr. Schramm. You literally can have a free consultation over your phone. So if you have been hurt from a car accident or some other reason and you're not sure what to do, feel free to call the office. You can hop on our HIPAA secure FaceTime Doxy, and we can give you a complimentary consultation and give you some instruction on where to go and how to get taken care of. And that is really the easiest way that we can provide that service for people.
The Utah Injury Clinic changing the way they do business to keep you safe during the pandemic. All of their information is on your website, everybody, and they're on social media. It's worth taking a peek and also knowing what to do before you get in that accident. Doctor, thank you so much for joining us on GTU.
All right, thank you.
Up next on the show, everybody, we are using crystals. They can help you ease your stress. We'll be right back with more.